Over a 20-year period of time of me being a pro skier and traveling around the world and competing and doing all these films, I've done a lot of damage to my body. I've had 11 surgeries on my left knee. It's been a pretty horrific go. There's a bunch of doctors out there that have told me, hey, you're gonna have to have knee replacement. It's inevitable. I either had the choice to have knee replacement surgery, which you can't go back from that, or try something. And I tried stem cells.
Matt, our program here at Unique is a little different than probably what you've seen or gone through before. We're not just going to do a stem cell treatment. We're really going to do a lot of pre and post treatments and assessments. We really want to get as much data about you and about your knee as possible. We want to order an MRI just because you haven't had one in a while, really kind of get some measurements on where your cartilage is. But we also want to look at your physiology and really kind of measure where you're at in your walk, in your jog, in your gait. We're going to send you over to Altus to do some of those measurements and really kind of see how your body moves mechanically.
It's good to have as much knowledge walking in the door as possible.
That's our philosophy.
I want to use what we actually have out there, and I want to try something different out to rejuvenate my body. That's my goal.
Hi, man. I'm Dr. Krasny.
Nice to meet you, man. Matt Reardon.
Nice to meet you, too. So you're a skier?
I am.
Well, I can see that your knee's had a pretty tough life. On the medial side of the knee, you basically have almost no cartilage at all. So we're seeing fluid and bone and bone. And cartilage would be an intermediate signal, or sort of a grayish signal there. So, for example, there's a little bit of cartilage right here, and then a little divot there. But there's no cartilage out on the medial side of the knee. So this is the part where I'd be most interested in is what happens if we can see any appreciable change.
It kind of can't get much worse.
This can't get much worse, no.
I spoke to Dr. Krasny at Resolution Imaging, and he basically gave me a summary of the situation in your left knee. There's only about 10% of your cartilage left on the medial or middle half of your knee, and there's a significant amount damaged on the outer half of your knee.
Yeah.
So our goal is to use the thicker version of the stem cells as a lattice or a building block to scaffold more cartilage cells and grow on the medial side.
Okay.
And use the thinner version of the stem cells to really kind of heal and give a better environment in the rest of the joint.
I'm psyched. Thanks, doctor.
All right.
It's a humbling experience for sure to go on this journey with Dr. Mark, who really is a pioneer in that whole leading the way of trying to get people back to leading a healthy life. And that's what it's about. We know that stem cells have this amazing ability to hold the blueprint for your body. And when you injure yourself, you need to have your blueprint like it was in the beginning. It's the smartest thing that we have going on inside of our body that knows how to cure our own body. So why not try it? When I walked into that surgery, I could not exercise. I could not do a lot of cardio. I was just in a lot of pain. And I felt lethargic. And after doing the procedure, I hit my A game again. I'm 6 months out of doing stem cell surgery, and I absolutely feel incredible. I can say that without a doubt, that I actually wake up every day and I put my legs down and I feel even. I rely on flexibility and my agility to be able to react at a moment's notice and being able to change up whatever the way I position my body on the snow, and it's everything. In the last 6 months, I've gained more flexibility than I've had since 1998. I've got a vitality going on where my skin feels better, I sleep better. I notice the whites of my eyes, they're whiter. Recently, I got to go to British Columbia. We did this TV show called Adventures in the White Room. I was pinching myself because I was in so much pain last year at the same time, and then I was in this position this year, and I was getting to ski with Chuck Patterson and Darren Rawls. I was out there with Jeff Ingebrigtsen, my really good buddy, and I wasn't just going insane. I was still testing the waters, but man, I felt good. I'll tell you this one line that I got to ski with Darren, it was so cool. And we skied this 2,500 foot face. And he said to me, he's like, all right, you take the lead. And so I led, and he's like, halfway down, just scrub your speed. We're gonna high five, and then I'll take the lead. We got to the bottom, and I honestly, man, it was almost like tears. One of these moments where I was like, yeah, I got this. I can do this. I can do this again. If you can have an injection with stem cells that can go into your body and use your own body's parts to fix your own body because it knows the original roadmap. And if you believe in that working, and if you do the work, look man, the possibilities are endless. As you get to be 46 years old, it's like, oh, you know, I want to go out and still get rad and be young at heart and everything, but actually my whole focus now is just all about this. My little one on the way.
Around in there. Oh my God, no way.
That is amazing.
The focus is totally different now. It's like I'm going to be a dad. And that's like my next expedition, if you will.